My name is Orode Doherty. I'm a pediatrician and I currently work as country director for Africa, which is an international non-governmental organization. One of the things that we have failed at abysmally as healthcare providers is continuing to maintain the trust of the people in what we do, in the services we provide. 70% of the healthcare which comes to the private sector is actually provided by the informal sector. People close to the people in their communities, patent medicine vendors, people whom they can trust. So from where I sit, what we've picked up on really is a trust deficit. That's sort of the first big thing. And the questions that we're going to be asking ourselves are what has come about this erosion of trust? What has led to it? What have the consequences of this been? And how do we, as healthcare practitioners, from a wide sort of set of experiences, begin to correct those inconsistencies and gaps? What are we going to do about it? In some cases, technology may be able to solve some of our problems, but technology can only be applied when there is an intention to change. So helping people really see that there are solutions, but you've got to apply them, and then you've got to measure and be consistent about what it is that you're measuring and you're reporting, so that we who are proffering solutions are in a position to make them better in order that your work is better. You know, if you want to solve a problem, you've got to get close to it. You've got to go to death row where the people are and experience what they're experiencing and hear their stories. And backtrack from that is the reason why communities are important, obviously, is because that's where the greatest number of people are. One of the greatest shortcomings we have in the clinical healthcare space in Nigeria is that even the available equipment is geared towards adult care, whereas the greatest proportion of our population is actually young children. So one of the things that we even want to begin to help people think about is what do you see on a daily basis? How many people do you actually see? How many of them need care? How many of them need, for example, diagnostics? To what extent is that children, adults? What's the breakdown? You cannot do anything for the healthcare system if you do not know what the real numbers are. We still don't know how much malaria we have in Nigeria. We still don't know how much typhoid fever, if we have in Nigeria, how much of it we have. You know, what we do is we just gauge it and then we throw commodities at them. Well, now we know whether these people need 6,000, these people need 600. Very many Nigerians have a cell phone today. There is already an opportunity to educate around children, newborns, adolescents using the cell phone. Those apps exist, but how many people are using them? How do we get them to become more user-friendly? This is just the beginning, it's the tip of the iceberg. In Rivers and in Uyo, we basically can have a clinician sit down with a card reader. It's a very simple, it's a card reader. And he slides the test, the same rapid diagnostic test we use everywhere in the country that's approved by the federal government, slides it in, but he's got to follow the steps. And it tells you, please put your blood in now, put the buffer in now. You put in too much buffer, repeat the test. And it guides you so that you do the test accurately. By the time you've done this for 1,000 times, you become an expert, you find that you're having fewer errors. That's one thing. So it was guiding the clinicians. The other thing was that it could automatically send your result, positive, negative, invalid, directly into DHIS, which is a platform that where we report malaria to nationally. What this did, it told us where there was malaria and where there was not, because it increased diagnostic accuracy. So there's a whole lot more that we can do. I'm excited because I think we're in a place where we're going to revolutionize healthcare and we're going to really get the best outcomes for our children.